Hello guys, I am back with another video on thyroid disorders. So let us begin. So guys, first of all, you need to understand the biosynthesis of thyroid hormones. So first of all, I'll give you an orientation. So this is so the color red is for the blood. Okay. The color yellow is for the cells. Okay, cells, and colored is by the green color. Okay. See, wait, green color. Yeah, okay. So, so iodide is important for the synthesis of this thyroid hormone. So first, the iodide is transferred from the capillary into the thyroid cell. Okay, and then from cell into the colloid. Okay, this is these are the first and second steps of the process of formation of thyroid hormones. Now, then there is a incorporation of thyroid hormones into the thyroglobulin. Now, this thyroglobulin is a molecule which is produced by the rough endoplasmic reticulum of the cells of the thyroid gland, and the residue is usually tyrosine. Tyrosine is an amino acid. Okay, so with the help of the thyroglobulin is made. Okay, then this thyroglobulin is transferred into the colloid. Okay, and then there is incorporation of the iodine into the thyroglobulin to form the MIT and DIT. Okay, so MIT is also called as monoiodothyronine. Okay, and DIT is called as diiodothyronine. Okay, then this one monoiodo and one DIT, it combines to form the T3. Okay, and when two DITs combine to form T4. Okay, so this is called as a coupling of iodothyronines, and then there is T3 and T4 release into cells, and then there is proteolysis of this T4 and T3, and then the T4 and T3, they are released into the blood. Okay, now as you all know that the blood approximately 99.9% of this T3 and T4, they are bound to plasma. Okay, they are not useful in the body. They are metabolically inactive. Okay, yeah, only 0.1 to 0.9% of the T3 and T4 are useful. Okay, so that is the physiology of the thyroid gland, of the synthesis of a thyroid hormone. Now we'll discuss about the primary hypothyroidism versus the secondary hypothyroidism. So in the name itself, we can guess the disease. Like in primary hypothyroidism, what happens that there is a defect in the thyroid gland itself. Okay, and in secondary, there is defect in the hypothalamic pituitary axis. Okay, then there are many disorders in the primary hypothyroidism. These are the thyroiditis, autoimmune thyroiditis, dietary, iodine deficiency, drugs that block iodine thyroid hormone biosynthesis, and the thyroid surgery or radiation. Okay, and this secondary hypothyroidism is caused by the TSH deficiency. Okay, so guys, now let us talk about the Hashimoto thyroiditis. So the common cause of this disease is unknown, but there is some genetic and environmental factors likely play a role, and the mechanism is like there are some epigenetic modifications like HLA-DR3 and the HLA-DR5. Okay, and there is some antibody production towards the TBO, that is the thyroid peroxidase, and thyroglobulin. So anti-TP and anti-TG antibodies are produced. So this will cause a uh, this will destroy the thyroid tissue. Okay. So guys, first of all, the patients who are coming to our clinic with suspicion of Hashimoto's thyroiditis, they only complain of a lump in the neck. Okay, they won't complain of any of the symptom of hypothyroidism. Okay, now goiter, the non-tender or painless. And this is important. Painless goiter. Okay, painless and symmetrical enlargement is also important. Okay, and as there is a destruction of the tissue, there is release of T3 T4 that will cause a transient hyperthyroidism. Okay, that is called as a Hashimotoxicosis. Okay, and in the late stage there is a hypothyroidism development with cold intolerance and constipation fatigue. Here are some patients which are suffering from the Hashimoto thyroiditis. You can see the coarse faces and also the puffy face of this female. Okay. Um. Yeah. And this is due to the deposition of glycosaminoglycans in the soft tissue of the body. Okay. Now you will tell me the laboratory studies. Okay. Thyroid function test. What will happen in early stage? Early stage. Okay. There is a transient hashitoxicosis. Now hashitoxicosis, it means the pre-T4 and pre-T3 will increase. Okay. And due to the negative feedback, the TSH will decrease. Right. In progression, that is a subclinical hypothyroidism, mildly there will be increase in TSH and normal pre-T3 and pre-T4. Okay, and in the late stage, what will happen? There will be overt hypothyroidism. This is characterized by increased TSH and decreased FT4 and FT3. Okay, and the best method to diagnose this Hashimoto thyroiditis is the anti-TPO and the anti-TG antibodies. Okay. Now, when we do the fine needle aspirin cytology, there are focal nodules, and also there is a Hurdle cell and the oncotic metablastic cells. Hurdle cell and the oncotic metablastic cells are important. Okay. Treatment is straightforward. We use a levothyroxine to the lifelong levothyroxine. Now comes the pros. Pearl. So if you are watching this till the end, please comment down below that yeah. And patient with Hashimoto thyroiditis are at increased risk of having or developing autoimmune diseases like type 1 diabetes mellitus, SLE, Graves' disease, Addison's disease, and non-Hodgkin lymphoma. Okay, so that wraps up our today's discussion. Um, in my next video, I'll be discussing about the secondary hypothyroidism, and yeah. So subscribe. Thank you. Bye.